from the founders. Okay, we have three more companies, and we have the most amazing Elaina here from CAUHEC. Go ahead, Elaina.
Oh my gosh. I just left my clinical advisor's office and she hit me with the sentence. If you don't find a preceptor, you can't graduate. Excuse me, what? Now, for those of you who don't, who are wondering what a preceptor is a healthcare professional that works in a hospital or a clinic, and they train students, bridging the gap between the classroom and real patient care. It's like pilots who only learn how to fly sitting in a classroom. You would fly with them, right? Of course not. Of course not. The same goes for doctors and nurses who train without a preceptor. Now, for me, I've tried everything: emails, phone calls, knocking on clinic doors like I'm selling Girl Scout cookies. Nothing's working. My classmates are just as desperate. Why? There's a projected shortage of 200,000 nurses and 124,000 doctors by 2030. And the pipeline is breaking at the clinical placement stage. So, last semester I used a service, paid $2,000 out of pocket to find a preceptor that wasn't even a good match. Then I found CAUHEC Connect. Within seconds, I had a list of available preceptors, and within hours, I was matched with someone that aligned with my career goals. Hello, everyone. My name is Elaina McAdams. I'm founder and CEO of CAUHEC. CAUHEC Connect is the first of its kind marketplace SaaS platform that's solving one of healthcare education's biggest bottlenecks: clinical placements. And we're not just a startup with a dream. We have over 60 years of experience in healthcare, technology, business, and in education, with doctorate level expertise. We know this industry inside and out. It's like Uber, but for clinical matching. Students get placed 70% faster. College and universities are able to increase enrollment by over 30%. And unlike anything else in the market, the students are given the power to find their preceptor with ease, ensuring fair and open access to everyone. Now, I want to be really clear. Preceptors are the backbone and a vital link between the classroom and real patient care. And with a shortage of over 324,000 healthcare workers, we can no longer afford to use um, outdated placement methods. Now, I know you're wondering, there's a lot of money in this. No one's in it. We're currently in the Apple Store and the Google Play Store. We launched about a month ago. Before we even started any marketing, we had over 200 organic downloads. And in the past week, we've secured meetings with 2 schools to do a pilot for a market fit. We're in the process of raising seed for $2.8 million to do a national expansion. And it's not just an investment, it's an opportunity to solve a $12 billion healthcare workforce problem. So together, we can change a broken system to one that connects talent, fosters growth, and saves lives. So if you're ready to be part of the solution, I'd love to talk a little more about it. Thank you for your time. Thanks for having this event, and I'm open for any questions you may have.
Thanks, Elaina. My main question is, how do you plan on using the capital raise?
2 main things. Number one, because we put so much money into just getting to market, we need to have full-time dev staff. So full-time CTO, a developer, a full stack developer, and then also marketing. At the end of the day, marketplaces are hard. For those of you that you guys know, it's really, really hard. Marketplace access are hard. This is a little different because essentially, and I'm going to use a sports analogy, so hopefully it works. Preceptors are like the student athletes before NIL. So they're essentially being asked to do a lot of work for free. And so what this does, they have to be educated on, hey, you don't need to continue to work for free. I mean, schools are making money on tuition. there are a lot of people making money off your backs, and hospitals really are looking for innovative ways to retain. So what we're doing is a lot of education marketing between emails, conferences, digital media marketing. But once they know about it, people are just signing up. People are looking for the solution. For those of you who are familiar with the App Store, there are millions of apps, and most apps never get one download. And we had 200 in the first couple of weeks, and also in 5 countries, which I thought was pretty interesting.
Thank you. Quick question for student, how much does it cost your services? What's the price?
So right now, our competition, which has less than 1% of the market, the minimum entry is $2,000 a semester. For this, a student, a preceptor can say, hey, I really don't want to charge a lot of money. They can charge $250. We just take 20%. That's our rev share with the preceptor. But for the SaaS, the B2B component, that's about a 90% rev share, because now essentially we're big data. Now we have data that no one else has access to. We're able to pull folks from behind that curtain and allow those schools to see who's available in that area so they can increase their enrollment sustainably, because they have to have approval from the board.
I have to say, I really appreciate this product. I was a former nurse's aide who was running across hallways with 6 phones in my pocket in no time. But I'm struggling to see, so how do you incentivize the people using this product to, enter the workforce? Because I think that's a huge part of the shortages, right?
Actually, no. So let me give you a couple stories. So I was talking to a PA program in Ohio. As a PA program, they had 1,400 applicants. So there isn't a shortage of people who want to go to school. They can only accept 50 because the board up there says, hey, if you can't show that you can place more than 50 students, we can't approve you. So what this will do is essentially allow these schools to expand so they can maybe admit 100 people next year. But right now they're hovering around 40 to 45 because they can't, sustainably keep them placed. So there's a lot of money, a lot of opportunity there to expand.
Quick question. So our team has looked at companies like Stepful before as well. So ones that offer higher education continue.
We can't hear anymore.
I guess I'd be
There we
curious
go.
to hear how you're thinking about marketing positioning relative to some of those education-oriented platforms.
Yeah, so we solve a problem in a very practical way. So typically, for those of you who are aware of how like these clinical rotations work, a lot of times you just go where you can find a placement. So you may want to become a NICU nurse or a you name it, a physical therapist in the pediatric department. But when you're in school, you can only go where people are like, hey, yeah, I can take you. So from a pipeline standpoint, now you'll have some visibility into where are the NICU nurses who want to take students, where are the physicians. I've actually had quite a bit of interest from physicians, especially in DO programs where they can't get matched by July 1st. And they're out to their own devices and usually have to wait another year to be able to be matched. And so this will resolve this for them as well. So these schools who are having problems getting those folks to their residencies can match them as well, which most programs just really can't do.
And on the piece of that, you mentioned that you can increase enrollment for schools. Have you considered like white labeling and selling it to the school, and then the students have access to it for free, and then the school itself is a player in that B2B model?
Yeah, so with our patent, we submitted our non-provisional patent a few months ago. Yes, we have considered that, but here's the rub. Healthcare is so siloed, so all these schools are competing against each other for the same clinical placements, and then all of the hospitals are competing for the same, for the same students to come into work for them. So we're agnostic. So literally it creates a level of transparency that a school can't provide. So if you think about like USC and UCLA, if UCLA has a program, well, USC is not going to send their students over there to do that. So what this does, it pulls everyone from behind the curtain and actually gives schools visibility they currently do not have at all, which they need. So they can say, go to the board and say, hey, now we see there are 1,500 clinicians within a 20-mile radius, so we can sustainably increase our enrollment.
Amazing. We'll take one more question from either the online judges or the judges here in the room. One more question for Elaina.
Rather than a question, I have a statement. I recently got connected to a dean of a nursing school I don't see any contact information of yours. I can connect you with that, the dean, if that helps your cause.
Yes, it will. Most nursing schools, and I would say any type of health science program, they're all struggling with this. There isn't one that you can ask that isn't dealing with trying to get high quality clinical placements for them. So I can for sure share my information.
Yay! Round of applause for Elaina. Great job. Thank you so much. Nice work.